So I am here to talk about using a virtual syllabus to effectively reach remote access patients. And as Diane mentioned, I am a sport physio manual therapist in Toronto, and I also do pelvic health. So I have a broad scope. I do have the disclosure of being the owner of Pivot and Pivot Dancer, which is what we're going to talk about today. And I know you all just went, we're not talking about dancers and high performance, but I'm going to encourage you to just think outside the box for a second. And this is what we all had to do during the pandemic, was think outside the box, because I went into physical therapy because there was no such thing as an unemployed physical therapist, but the pandemic made an unemployed physical therapist. So what do you do when life gives you lemons and says you can't do that? Well, you turn your lemons into lemonade, or in my case, cupcakes, because I do enjoy a kitchen full of cupcakes and people. And what I decided to do was look at how I could branch Pivot effectively. And I branched it into this online format for a very niche clientele, which was Pivot Dancer. And that gave this branch a structure and focus. But it also opened this opportunity for delivery of care options. And I looked at what were the patient needs, right? During the pandemic, we really had a loss of access to physio, to trusted resources. We had people who needed to maintain activity, people who really needed community. It was very isolating for many, many people. And with that came this loss of joy without this sense of community and purpose and sharing. So I really jumped into being a very non-techie person to discovering the internet. And what I discovered was that the internet was moving a mile a minute, or at viral speed, you might say, during COVID. And there was fabulous software that was popping up. So I dove into many of the softwares, not so much to YouTube, Andrea, I'll have to put that on my list. But these were some of the things that I explored. So using Embodia, which is a fantastic patient tool, really effectively using Zoom, Stripe to integrate payment automatically, using Instagram, Facebook, live streams, podcasting. I am not a good public speaker, but I learned to do this. Inviting people in from around the world, I agree, the resources that we have in Canada are almost so much better than many other places. And I find that my clientele does tend to be global. I also did a little shopping. I found that the experience of working on the internet with some simple tools like a good microphone, a nice light, really enhanced the opportunity for it to be a positive experience. And like I said, everything is global, and I find this fascinating. So I'm going to play you a little segment, and you'll be able to pick out words, even if you don't speak Spanish, that say, oh, I understand what this person is talking about.
Pues estos entrenamientos se dan a través de una plataforma que se llama Pivot Dancer, la cual fue creada por dos fisioterapeutas canadienses, una especializada en bailarines y la otra especializada en deportistas de alto rendimiento.
So, here is an example of an individual who lives in Mexico who's been using our program, and effectively and awesomely, he's recovered several injuries from this, and really shows that our geography and language don't have that much of a barrier as we might think they have. So it's worth jumping in and using a resource that you may not think works and try it. We run on different modules, and I'll play you just a tiny segment of what an exercise module would look like and talk about those. So we're going to do an exercise to work on lengthening. So we have exercises that are pre-recorded, much like a YouTube video, but only live in the subscription. We have group classes where we have multiple people show up at once on the same Zoom screen, and we have one-on-one available. And it really works through this super easy to use app. So you can take us anywhere. It's very convenient. People use this app on their computers, but also on their phones. They can scroll through and see what classes are offered. They can look to see what exercises are available or what appointments are available. In the on-demand, they can go through different recorded classes, tips, tools, advice, different exercises. If you're working with a therapist, so if I have my patients in the program, I will specifically say, go into the core section, go into the foot section, or pick out exactly which exercises I want them to use. So it's very, very easy to navigate, and it makes it incredibly convenient for people, removing the barriers of having to schedule or having to get somewhere. They can do these in between what else they're doing in life, which is, very nice, simple, and a way that is encouraging, right? Because you're just always there with them. Again, easy to see that you can pull up an exercise.
We're going to do some box breathing. If you want,
and follow
you can
along.
put hand on tummy, hand on ribs. You want to make sure that your tummy and your rib cage are moving when you're breathing. Box breathing, we're going to breathe around a box. So you're going to inhale through your nose and count to 4.
So just showing you that the exercises are not all dance-based, because dancers actually need to do things like breathe and, stretch and strengthen as well. And I wanted to show you that this program is used by non-dancers. So here's one of my non-dancers really effectively using this tool.
Hi, my name is Dolly. I had a knee replacement on March 13th. I am doing teletherapy now with Dinah from Pivot, and it's working out really well. Here are some of the lunges we learned today.
And Dolly did amazing. So Dolly learned how to use the internet as well. It's very, very easy to use. And, you may not think, oh my gosh, why would I refer my total knee replacement patient to a dancer program? Well, because the exercises are good, they're quality, they're done by healthcare professionals, and the patients have the option of these live and on-demand platform, which improves their overall compliance, right? If they don't have to try and get to a facility or only attend a live appointment. We found really that people enjoyed this. So their mental health benefit is as good in addition to their physical health benefit. It is a trustworthy complement. So if your patients are seeing a therapist or have an exercise program that they do, this is a nice complement because it is very inexpensive, which makes it financially accessible to supplement in. It's kind of like the expense of seeing the dentist regularly versus the expense of buying your toothbrush and your dental floss, right? So it gives that inexpensive option for people. So really, in conclusion, make your lemons into lemonade or cupcakes if you're me. There are amazing virtual tools, and this really does open up options for patients who live remotely or people who just need a little bit more. It opens options for practitioners to explore other avenues of care to supplement what they're doing, improve patient compliance and joy. The care that is delivered really is effective. People like it. It can be financially feasible for many people. And, thinking outside of the box is fun. I think it's been a really interesting experience to explore other options and avenues. So I encourage you to have fun. And when you see a problem or a barrier, don't be afraid to go somewhere that's a little weird and say, I wonder if that program might work, because often it just might. And, as per Andrea, I do encourage people to get in touch. I'm very, very active on social media. So please jump in. There are loads of complimentary tips, tricks, education tools, and I'm very responsive by email or telephone. whatever. If you show up at my door, I am a true Newfoundlander, I will open it. So there you go. That is my presentation.
Great. Thanks so much, Dinah. It's just neat to see how these things flip back and forth and just the level of creativity. And again, with thinking about how do we make things easier for people. Everything's complicated. And again, sometimes as we've heard today, getting parking or getting out of the house just doesn't work. Or if you live somewhere, how do you get good quality healthcare with the exercise component? So thank you so much. That's great. And Dinah will be around at the end as well to for part of our question and answer.